The mobile barber truck is new. We just launched it the fourth quarter of 2024.
This enables us to speak to crowds and reach people we normally wouldn't be able to reach. All of our barbers are trained on mental health first aid, and we're getting them trained on calm. And so these are evidence-based programs, evidence-based initiatives that our barbers use to reach clients. That's been so helpful in our work.
The concept of having barbers actually be an agent of change, to be somebody who could engage in a very interesting way, in a very special way. Barbers play a key role. They're a person that will have often a years-long relationship with their clients, seeing them once every week, once every 2 weeks, and they're an ideal position to know if something's different for somebody.
We really have a way of making people feel confident, making people feel heard, making people feel loved. Sometimes we're the only consistent good thing in people's life. You know my buddy, Lil Albert, right?
Yeah.
This is kind of be the one place they can consistently go to be served and be loved on and be, boosted up before they leave back out and fight the world.
The research gave us suggested three places that we should, particularly in Black and brown communities, that we should focus. One of them is the Black church. The second one was actually funeral homes. And the third one was barbershops. And from a historical perspective, barbershops have always been a place where you can mobilize, build community. What this has done for us and enabled us to expand this safe space and carry it with us into communities. So the next phase of what we're doing is we are going into other communities where we're utilizing data to tell us where to go and what drives it. And so that really is going to drive and transform some of the work that we're doing.
I started the Suicide Prevention Institute with two of us in 2022. In the last couple of years, we've grown to a team of about 50 people, and we try to prevent suicide however and wherever we can. And we know that there are some groups that are at greater risk of suicide these days, particularly Black youth. The rates have gone up markedly. And one of the things we've been trying to do is to reach out to people who have access to Black communities and to do suicide prevention in those spaces and in those contexts, ones that we typically would not reach.
As we were beginning to start the intervention, start the conversation, and we were able to kind of reach them at that level. And for us, I know in working with Black and brown communities, you got to start with physical health before you can get to mental health.
The understanding of how to respond has reduced some of the anxiety that we might have had in the past.
Recently, we had someone at the barbershop who was actively suicidal. They had left the shop, and so the barber called me and asked me, what can I do? He was able to do a warm handoff, and I was able to get him to talk with the client, and eventually I was able to connect with the client, and we were able to address the client, talk with the client. They know now we're doing this heavy push, you'll see a little bit about 988 in the Peer Warm line.
988 is a amazing number that I think everyone should have in the back of their mind, just like 911. It's one of those numbers that could really change the trajectory of a person who was in a mental health crisis, who is thinking about ending their life. We know if we can just save one life, that's going to affect many other lives. So we're really passionate about trying to reduce the suicide rates in North Carolina. We also put out gun locks throughout so many barbershops in the Raleigh, Durham, and again, Wake Forest and Cary area, but there was no hesitation from barbers anywhere. And it really helped start the conversation about gun safety.
The way this is important for UNC and for the Suicide Prevention Institute is consistent with our goal. We want to prevent suicide however and wherever we can. We use the data to guide our efforts, and we know that increased risk of suicide and suicidal behavior is not randomly distributed in the population, but there's certain segments that are higher.
I think first, as far as increasing the exposure of the work that we're doing, I think when the name UNC is attached to the work, it gives a degree of credibility that we didn't have before. And so from a community perspective, it has just definitely been helpful for that.
We're really excited. We just want to say thank you to UNC for, like I said, giving us this platform and putting us in a place where we can do more with our impact.